Hello and welcome to the Center for Healthy Sex webinar series. I'm Douglas Evans, Executive Director at Center for Healthy Sex, and it's my privilege and honor to present to you Dr. Stefanie Carnes, who will be presenting today. Before I do, I just want to let you know that our special book, Mirror of Intimacy, is now available on Amazon. It's a book of daily meditations on healthy sexuality and emotional intimacy. So you may want to check that out. It makes a great gift as well. We also offer 11-day intensives for sex and love addiction treatment for men and women, as well as a 6-day partners intensive. Today's presenter is Dr. Stefanie Carnes, the president of the International Institute of Trauma and Addiction Professionals. She's also a frequent national speaker, as well as university professor and certified sex addiction therapist. Dr. Carnes is the author of Mending a Shattered Heart and Facing Heartbreak, which is a partner's guide for treatment and help, as well as Facing Addiction. Today, Dr. Carnes will present to us on the traumatic impact of sex addiction on the family system. Welcome, Stefanie.
So our agenda for today is the traumatic impact on the partner and treating that trauma, and a little bit of an overview of facilitated disclosure and how that impacts the system, the impact on children and treatment of children, which is a really tall order. So this is very much an overview. And what we will focus on today will mainly be focused on partners and children, but a lot of it is also can be applied to other close relationships, like parents, for example, or close siblings. So many of you probably heard of disclosure and staggered disclosure. I'm assuming some of you might be new to this issue. So basically, it's what happens with addiction as the addiction continues to progress and the addict starts to hit bottom, a huge secret double life starts to develop. And you can see this is a client drawing that drew this picture. His life just completely exploded when his lies were discovered. And it's not uncommon, and usually what happens is the partner starts to make discoveries of this secret double life, and it becomes an unfolding process. And the typical process of disclosure from the addict is to deny everything that's going on, disclose what they think that they can get away with, disclose a bit more, get confronted as more comes out, and then disclose all. And this process tends to repeat itself, and we call it staggered disclosure. Now, unfortunately, this is just devastating for the trust in the coupleship, because the addict is saying, no, really, this is everything now, you should believe me now. And the partner, it just doesn't know what to believe. And from the addict's perspective, staggered disclosure is usually an attempt at damage control. They're afraid of hurting the partner. They're afraid of how the partner is going to respond. And the majority of addicts, like 60% and about 70% of partners in this one research study, reported that there had been more than one major disclosure. Now, I think that that's actually probably a little low from what we see clinically. And usually clients coming to therapy after this process has already exploded on them. And so that really puts therapists on sort of cleanup of the damage that this staggered disclosure process has done. And this is really, what research has shown is that this is really a traumatic event for partners to be making these discoveries, because they believed their life was one thing, and then it unfolds that it's completely something else. And so really this is a new area of research, relatively new psychologically speaking in the literature. Barbara Steffens and Rennie did a study in 2006 that actually measured partners post-disclosure and saw that they had symptoms of acute stress disorder and PTSD post-disclosure, and their numbers for PTSD were about 70%. So not everybody, there is variability in responses. Some partners will be just completely devastated and be really, really struggling to cope. And other partners will be, have a lot less symptoms. So there's a wide variety of responses. But as Barbara discovered, about 70% were experiencing symptoms of PTSD, which is a lot. And so it's it has a very profound impact on the partner. And I think prior to this, we in the field of sex addiction, we really neglected that aspect of the partner's experience. And in the last, 8-10 years, we've grown much more sensitive to this aspect of partner trauma and what the partner is experiencing, and become much better at treating that. Another area of focus that has been an area of focus for both myself and another individual named Omar Minwala, he started looking at this area of partner sexuality and how the partner's sexuality is really wounded by this experience of the addict's sex addiction, and it really has a traumatic impact. He did qualitative research studies that asked groups of partners how this experience impacted their sexuality, and what they noted was that they had symptoms similar to like rape trauma survivors and sexual abuse survivors, like shame and body image issues and trauma reactions that they were experiencing similar to sexual abuse survivors. And since then, I have done quantitative research in this area and developed a assessment tool for partners, which is in press at the moment in a publication. So I want to emphasize that while I don't want to minimize the impact of infidelity on relationships, that disclosure in sex addiction is really different than infidelity. And infidelity is absolutely devastating as well and can be traumatic. But what's different about sex addiction is that it usually has, there's another layer because there tends to be a lot of information that the partner doesn't know. So it's this whole other life that gets exposed, and it sort of shatters their reality of what they thought their life was. And so it really is a huge shift for them, and it's very hard to assimilate that psychologically. And so I think it's different than just struggling with infidelity. I think they're two different things. This was a quote from one of the participants in one of my research studies. My life has been turned upside down, but because everything about sex addiction and its victims is kept a secret, I'm denied the usual support of friends and family, despite the fact that my world has been shattered while my husband's life goes on like usual without any external consequences or changes for him. So oftentimes, because of the stigma of sex addiction, family members feel like they can't talk to anybody about it. Yet this is a major traumatic event. And so usually when families are going through a major trauma, like let's say cancer, for example, the community rallies around them and, try and offers support. Like we build Caring Bridge websites and people bring casseroles and things like that when something major happens. But with sex addiction, a lot of times family members feel like they can't turn to anybody and they can't talk to anybody about it. So that adds an additional layer of difficulty in terms with coping and struggling to get support. And the level of trauma for the partners is really influenced, I think, by a lot of different things. First of all, the amount of deception and the length of time of the deception. So all these cases are really not all created equally. Somebody that has a situation where there's 20 years of deception and the deceit goes very deep and is very profound is going to be highly traumatized. I had a case once where the addict had a calendar of all the places he was going and a separate calendar of all the places he told his wife he was going. He was just meticulous in the way he covered his tracks and the layers of deception. So for her, when she had her discovery process, it was just like getting the rug pulled out from underneath of her. So that really plays in, is a factor into how much trauma the partner experiences. Additionally, the amount of what we call gaslighting, or I call it facing heartbreak, covert emotional abuse. And that is really the addict's manipulation around his or her behavior. And so, for example, I'll share another case with you. I had a case in which the addict had many repeated affairs and then a period of sobriety and seemed to be doing well. And the partner was starting to get very, he started to notice some things and started to suspect a relapse. And so was questioning the addict and asking the addict, starting to ask the addict questions and confronting the addict. And the addict's reaction was like, you are such a grudge holder. When are you going to get over this? This is about you because you can't let anything go. And really kind of turned the table on her and tried to put it back on her. And that very next morning, she discovered that he was indeed having another affair. So her gut was telling her the right information, and she was confronting about it, and it was being manipulated and twisted into her fault. We call that gaslighting. And it's very crazy making for the partner. And addicts really vary on the amount of this that they do. You have some addicts that are huge gaslighters and some that aren't. And that really impacts the amount of trauma that the partner experiences. Also, the type of acting out or offending behavior. And this goes for all family members, children. It's not the same thing to find out that the addict is using porn or prostitutes. I don't want to minimize those because it can be very painful for people. But as finding, like, for example, child pornography or significant offending behavior or some paraphilias that can be very disturbing, or sometimes, maybe acting out with the same-sex behavior. And so the type of behavior that the addict's engaging in can really also influence the trauma experienced by the partner. Additionally, the level of exposure to the acting out. In just a couple of months ago, a group, I had a partner that walked in on the addict having sex with somebody in their bedroom. Came home early, and you've all heard that kind of story, but that happened to her, and she was extremely traumatized by that visual. Another example is just like a partner that gets exposed to, like, the addict's hardcore pornography that they've gotten involved in an escalating porn addiction. Oftentimes partners are not used to that level of hardcore pornography. And those kind of images can flash back in their memories and cause PTSD-type symptoms. Additionally, public embarrassment, if the addict happens to be a public figure, or if the acting out is very public, that can be very traumatic. The impact, if there's impact on the children or impact on the finances, can also be very difficult. So oftentimes these types of traumas trigger a lot of different responses. Emotional turmoil, fear that manifests as protective behaviors, like checking the addict and following up on the addict, those types of things, obsessing about the trauma, Avoidance of wanting to think about it. That's a very common PTSD symptom, just of wanting to push it and distract and avoid, not wanting to discuss it. Intrusive thinking about the addiction or acting out behaviors, sleeplessness, nightmares, all of those things. So this was a partner drawing of one of the partners I worked with, and the black is the shame that she feels just encircled with. So what happens with the coupleship is you get the addict sort of in these two mind frames. The addict is usually in a shame spiral as well when all of this is unfolding. This is an addict drawing, and they're just that, they're usually, oftentimes anyway, feeling very worthless, hopeless about the situation. And the partners, of course, are just devastated. This is a partner drawing, taking them prisoners. So you have what ends up being a very big rupture in the attachment bond for the couple. So this is the partner here cowering as the addict's on the crying while the addict's in the other room on the computer. And of course, anger on the part of the partner. This is the comic, I'm having my wedding ring melted down into a bullet. So you can see, oftentimes partners are just, feel like they're having a lot of anger and resentment accumulate as well as a result of all of this. So one of the things we'll see with the coupleship is sort of this common dynamic that unfolds in the coupleship of the partner kind of confronting and demanding. And of course, this is, I'm saying these are common, it's not 100% of the time, but confronting, demanding, wanting accountability and honesty from the addict, and the addict kind of trying to deny, avoid, not knowing how to respond to the partner's demands for honesty. And so typically there's a lot of increased anxiety in the coupleship, a lot of self-doubt, a lot of questioning, a lack of trust, hostility, and it's just a time of a lot of turmoil. This was a quote from one of Jennifer Schneider's participants in one of her research studies of a partner that just went through this disclosure process. She said, I couldn't concentrate. I got into 2 car accidents and did things like put milk in the cupboard and cereal in the refrigerator. So just really, really a struggle for couples oftentimes at this point. And as you can imagine, this has a trickle-down effect onto the children living in the home. And couples therapy. This is couples therapy not going well. So obviously this is oftentimes when couples come in, they can be very strained at this time, and it really is a lot for couples therapists to manage all of the dynamics between what's going on with the partner, what's going on with the addict. So it's very helpful for those of you that are therapists out there to get additional training on how to look at this whole system and interact with this whole system. Some of the areas in terms of the partner's sexuality, I mentioned before that this is an area that can really be impacted. These are the scales on my instrument, my assessment instrument. Relational sexual difficulties, so this is sexual dysfunction that relates to the relation impairment in the relationship, the lack of trust and intimacy in the relationship. Sexual aversion, the partner really not wanting to kind of sort of shutting down sexually. Sexual shame, body image issues, risk for abuse or injury. That was one of the things that surfaced in the research. There was a smaller group of partners that felt lack of safety in the relationship. Desire for retribution, sexual secrets. This is where the partner too has their own sexual secrets. Feelings of obligation, like, well, now that the addict's in recovery, I feel like I owe it to the addict to be sexual with him or her, or feel like I have to try, and that type of thing. Broken trust and health consequences. So the partner sexuality is really multifaceted. There's a lot of things going on, and that's why I created the tool so that people would have a way to kind of dig down. I have felt that we've focused a lot on what's going on with the addict sexuality, and they have a lot of resources, and there was really very little that was left for the partner, and it was only really, the partner sexuality was only really looked at when it was time to reintegrate that back in the coupleship, as opposed to really looking at what's going on with the partner for themselves. So I think that's important. This is just a few quotes from the study participants to give you a flavor of some of the ones in my study, how they were responding. So he's been in treatment for a year and we're trying to hold it together, but I hate having sex with him now. I feel cheap and dirty. Will this ever go away? I've had multiple plastic surgeries to feel more attractive and he still looks at porn. What's wrong with me? I began to internalize and took the blame for his inability to have a physical relationship with a woman. I thought it was something wrong with me. I find it difficult to trust him even on unsex-related issues. I'm disgusted with the thought of being touched. So you can see how profound this can be for the partners. I'm seeing that we have a lot of questions going through. I'm going to get to a stopping point, and I'll take a few questions about partners before we move on to children issues, and then I'll take questions at the end as well. So when looking at treatment for partners, I always emphasize to partners how important it is for them to have their own individual therapist. A lot of times partners, if the family only has a certain amount of resources, they'll often allocate those resources for the addict's treatment and say that they feel that the addict is the one that really needs the resources now. And I really try and challenge that for partners. I really suggest this is a traumatic situation for you too, and you really need support. You really need your own group to help get you through this. And I just think that's really important. We use a task model of therapy, the 30 task model that was developed by Patrick Carnes. My book, Facing Heartbreak, is part of that. That is the task model for partners. And so basically in that book, there are exercises and things that the partner can work through, and they can do that in their individual work or their group work, however that unfolds for them. Also doing trauma work, a lot more partners are doing trauma work with their individual therapists, things like art therapy, psychodrama, EMDR, somatic experiencing. There's so many, psychodrama, and there's just so many different options for good trauma work these days. And so I think that's a great adjunct to the partner's treatment. What I really think is important is a group support. A lot of times partners will feel like they can't talk to their normal social support network given the sort of sensitive nature of the information about sex addiction, and also a lot of the misunderstandings of sex addiction in the general population. And so it's really great to have a group of partners that get together that are going through the same thing, and it normalizes the process for them, and they can learn tools from one another, and it really decreases their shame. There is also the option of 12-step support. There are several options for partners of sex addicts. There's SNR, COSA, and now POSARC, which is the Partners of Sex Addicts group. That one does not use a codependency model. So for some of your clients that don't identify with codependency, that might be a better option for them. So different 12-step support groups. Spiritual support, family, couple work when appropriate, and I think these days we are seeing more and more practitioners integrating that couples therapy early on and really starting it, and oftentimes with the couples therapy at the beginning really starts, it's sort of like more like a crisis management, but really getting a couples therapist involved to help work on the relationship from a relational paradigm and a systemic paradigm, which I think is really important. And now these days there's a lot more really good books out there. So I'm sure that Douglas can get you a list of books if needed. But my books are Mending a Shattered Heart and Facing Heartbreak. They're easy to find on Amazon. I see treatment really as a three-legged stool for the coupleship. The addict has their own therapist, their own treatment programs and groups. The partner has their own therapist and group, and then there's a couple therapist. And I think that's really important to have all the components of that. Okay, I'm realizing that it's 10:30 already, and we're just launching into the disclosure process. So we do have a lot of more to cover. So I am going to go through talk about the disclosure process, and then we'll take just a couple questions, and then we'll save the questions till the end. Douglas, if you could look at a couple questions for me that relate to partners and what we've been talking about, and I'll get to those in just a second. Okay, if the couple is staying together, eventually a really important part of their treatment is doing a facilitated disclosure process. And basically this is a process that's structured, it's very well planned, and there's a lot of support involved. Usually it involves a team approach and co-therapy. And the idea is it's an opportunity for the addict to really lay out all the information about their addiction, any secrets or lies that they're still holding on to, and share that information with the partner. And the goal is to restore the foundation of honesty on which to rebuild the relationship. So this is really for couples who are committed to staying together and who are ready to move forward. And really it allows the partner a path to get all the information and a path to process their feelings about everything. And that's really important. This can be very traumatic, and let me just say that a disclosure should really be done by therapists who have been trained in how to do the process. There's actually several different methods now that are out there and being done, and I think there are mechanisms that are much more friendly to the partner and to really trying to provide a container of support for the partner as they go through the process, which is just critical. And so it's important to have somebody that's really a therapist that has training on how to do a good disclosure. And then the cleaning up the aftermath. The partner needs to be able to process their pain, narrate their pain, and express their pain to the addict. I often use what I call a partner impact letter. There's a copy of one of those in Facing Heartbreak, where the partner can really share with the addict how this has impacted them following a disclosure process and help them process and get through that. But it needs to be really validated as a trauma. And one of the things that I think is important is to discuss the level of addiction in light of the new information and really kind of process through that, because a lot of times after the disclosure, what I see for partners is they start to see the amount and really start to recognize it as an illness and start to get the disease concept. And that's really an important piece, because they start to sort of see how it's deteriorated and how nobody would really want this. This isn't about them. And I think that's critical for the partners to get. They also need to re-evaluate their boundaries post-disclosure, really get a lot of support, do their trauma work, and also they're going to need some help expressing appropriate anger. They're going to have a lot of anger, which is appropriate, and they need help channeling that in a way that's effective, that they can feel good about. I like partners to be able to feel like the process is honoring and that they can be proud of how they're responding and handling it. Okay, so now I will pause for a couple questions. Douglas, I know that I haven't been able to read all of these things as I've been going along, so is there a couple questions that you think would be good for me to answer?
Hi, Stephanie. This is Tom. And
Oh,
we're
hi,
not
Tom.
going to be able to, hi. We're not going to be able to get to everyone's questions, but we can email you later and we'll get some answers together for you with all the questions. We have a question that was emailed to us from Jennifer in Oregon, and she wants to know when she's out with her partner, she gets triggered, especially when they cross the path of a young, attractive woman. Is there any advice or tools for dealing with that?
Oh yeah, that's a pretty common problem. I see that more as reflective of the partner not feeling safety in the relationship at that point in time, and maybe not. I would wonder if everything was cleaned up in terms of the addict's. Is there still suspiciousness or any concerns about the addict's behavior in a situation like that? Because I think that partners have a pretty good gut instinct about what's going on, and so I would want to explore that more and understand what is going on for the partner and what's going on in the dynamics of the relationship. I think from the addict's perspective, the addicts need to, it's important in the therapy process for the addicts to learn how to really come back and be reassuring to the partner and to be able to just, to be really honest about their recovery. And so things like check-ins, regular check-ins between the couple, like, what's going on with each of them in their recovery process so that they feel really connected, so the partner feels connected to the addict. I think that when that kind of attachment bond is being restored, some of those triggers start to lessen. So I would kind of look at that as more of kind of a symptom of what's going on in the relationship for that couple right then.
Thanks, Stephanie. We have a question from Canada. Partner support seems to only have two models, the co-addict model versus the trauma model. And their experience was that the codependent or co-addict model wasn't the best for them. What do you think of these two models, and does the concept of co-addiction have a place anymore in therapy?
Yeah, that's a great question. So for those of you that are kind of new to the arena, in sex addiction treatment really kind of fell out of treatment for chemical dependency. A lot of times, like in the 80s and 90s, a lot of people, when they went to sex therapists for help, they would say, oh, there's no such thing as sex addiction, and they really didn't get any help. So addicts went and started their own 12-step programs. So really what was applied to chemical dependency families was really applied across the board to partners of sex addicts and families of sex addicts. And I think that when you look at the treatment, a lot of things with chemical dependency apply to the addict's treatment, but when you try and apply it to the family, it just doesn't apply. It's just so that crossover doesn't work. A lot of partners don't feel like they identify with codependency. And part of that, I think, is that they did not know a lot of this was going on. In the majority of the cases, they didn't see the addict drinking or the addict, doing overt behaviors. They were blindsided. And so a lot of the codependency material just doesn't translate in the same way. Now, that's not to say that there aren't some partners who might delve into the codependency literature, and if they identify with that could be helpful for them. But for most partners seeking treatment, that when therapists, in the past, when therapists would bring that model up, it just didn't resonate with them. And I remember, 8-10 years ago when I was trying to use the codependency model, I always felt like I was trying to fit a square peg in a round hole for partners of sex addicts. And but my earlier version of mending actually came from a codependency model. And through my own process of having experienced a disclosure in my own relationship with an addict, and really going through working with partners, I felt like it just wasn't a really good fit for most partners. So I actually revised that book in mending, 5-6 years ago, and eliminated that model from that book because I just didn't feel like it was a fit for everybody. So I don't use that model. I don't lead with that model. I don't teach from that model. I do teach some of the background, so the history of, where we came from in the field. But I think that the new research that has come out in recent years about the partner's trauma has been much more relevant and really resonates with partners. And I think that, so I think most clinicians these days are leading with that and not using the codependency model, or there are fewer out there using the codependency model these days. So it's been a growth process for the field and a change for the field. Everything with sex addiction is a continual, we continue to learn more and more about this disease every day. So we're making new progress. And in the areas of partners, I think this has been one of the areas where we've made a lot of progress in recent years. So, yeah. Well, I think we better move on to the next section, Tom, because we've got, I want to talk about children, and I'm hoping to take a couple more questions before we end. Okay, so this is a drawing, a partner drawing, and she's quite the addict's in treatment, and she's saying surreal, betrayal, anger, sadness, hope, question mark, and the little one's saying, when is Daddy coming home? And the older one says, how's Daddy? You don't sound very convincing. I know you're hiding something. So children really are picking up what's going on in the family. This was a case I worked with. He was 12 when he came to see me, but his father, he was 9 when he discovered his father had been using prostitutes in his room and also using pornography on his computer in his bedroom. Children can also be very impacted. And I think as what we talked about as applying for partners in terms of this being a trauma, I think this can be very traumatic for children as well. And if you look at, many of those things that impact the partner's trauma also impact the children's trauma, the public embarrassment, finances, the, what type of acting out, that all of those issues can really impact the children as well. The partner, the children's sexuality can also, if you look at the DSM and look under PTSD, anything that's sexually inappropriate given your age level can be considered a trauma. So by definition, this is a traumatic event, because learning about this kind of information for a child is an inappropriate amount of information given the child's age level. And so just that developmental inappropriateness can be a trauma to the child. Also, there's often a lot of secrecy in these families, and children get wrapped up in those secrets. They can end up being the secret keepers, or they're passed down to them. And this can create a lot of shame around like sexuality issues, like these are things we don't talk about in our family. And so that can be very challenging for children. Also, you can see caretaking and codependency develop when the children see, sort of the adult-child issues that develop in addictive families. When you see the parents struggling so much, like a partner that's falling apart or an addict that's falling apart, that really elicits caretaking on the part of the children. And the parents' needs all of a sudden are now superseding what the child's needs are. And that's a sort of a reversal that can create codependency later and create issues for the children as they get into their adult relationships. Also, loyalty issues. I've seen a lot of cases where the children are, triangulated, and either triangulated into an alliance on one side or the other. Like, for example, how could you do this to mom and not talking to you, and, kind of cutoffs and those types of things that can really create very challenging dynamics in the family to repair. Also, boundary failures. So, sex addiction is the disease of boundary failure, and it can be everything from children making the discoveries, such as in the case I mentioned earlier, and or just inappropriate sexual boundaries or content. I was recently involved with a case where the addict was a nudist, and that was the lifestyle in the home. And so that was he was, just a great example of a boundary failure. As he had little girls and he was walking around the house naked. And all of this can create a lot of confusion for the children about their sexuality and feelings about their sexuality, like concern, for young women, like, and young prepubescent and pubescent girls, like, now that I'm developing, what's the addict going to think about me with my body? And for boys, like the young boy that I worked with, that 12-year-old, he was experiencing normal attraction to girls and normal thoughts and thinking about girls, and he was concerned that he was going to be a sex addict. And so he was having all sorts of confusion. So really, they oftentimes just need education about what normal, healthy sexuality is. Now, there are different types of disclosure to children. The most challenging situations are forced disclosure situations. This is when like the addict is going to be on the 6 o'clock news or something like that, and the child needs all the information, and you're sort of forced to give it to them because otherwise they're going to get it from another non-nurturing source. And so that can be a real challenge. A softened disclosure is when the parents feel that the children need some information just because of maybe the child already has some information and they have to explain that type of thing. So like this would be like, in a softened disclosure, you don't tell the children that the parent is a sex addict. You don't use the term sex addict. So it's an explanation of the bare minimum of what needs to be explained. So, for example, mommy had a boyfriend. Mommy's not supposed to have a boyfriend. Daddy's supposed to be mommy's only boyfriend. Or, as you know, daddy was looking at people on the computer without their clothes on. This isn't part of our value system. Now we're going to be putting filters, and this is what this is. This is called pornography. This is not, not part of what we do, whatever it is. So when there needs to be some explanation to the children in the household, and oftentimes that's followed up by a delayed disclosure in which more information is shared with the children. This could be like when the child is maybe 17 or 18 and the addict wants to share their recovery with the child and give the child more information and be open and honest and, take responsibility for some things if, that is part of their work. So usually we recommend a bare minimum of mid-adolescence before sharing with the children that the parent is a sex addict. I like to do it a little bit older if possible. But a lot of it also depends on the developmental maturity level of the child and the information in the case. There are no two situations that are the same, and there are so many factors to consider when trying to figure out what to share with children. And an unbalanced one is that's what we call it when it's the angry partner sharing information with the child, sort of out of retaliation or anger towards the addict. And a discovery is when the child makes the discovery themselves. This was a study done by Schneider and Corley. These were the parents' descriptions of the children's reactions to disclosure: shock, disbelief, fear and sadness, tearfulness, expressed anger, validation of their suspicions or knowledge. Some appeared to understand but blocked out the info and were surprised when told again later. Attempts to comfort parents, and praise for parents seeking recovery. These were some quotes. I did a research study in 2002 with children. These were some of the quotes from the children. I can't be totally honest about anything anymore because I'm bound to keep his secret, so a good part of my life is a big fat lie now. I felt sick, horrified. What are other people going to think? Can I be left home alone with him? I felt like I wanted to punch them, but I just sat there. I was not crazy. I had known all along. I felt twinges of guilt and a sense of needing to protect my dad. My dad was going on about his being a sex addict and treatment and steps and other stuff that I could care less about. And the word bankruptcy came up because at the time we were being sued, and that really struck a chord with me. What did that mean for me? Would I lose my bike? So you can see some of those, those innocent child reactions. So really, the children also need their own process if possible. It's helpful sometimes to do family work and allow them to really share with the parent what this experience has been like for them. An impact letter from the child can be really very, very powerful. And also, I think with children, you really have to be careful of selecting their support network, their social support network as they go through this. What I know about kids is that, kids as peers can be just really nasty at school and teasing. And I don't really necessarily see school children as necessarily a good source of support. So being very selective about who they talk to. Doing trauma work for the children, trying to cultivate a safe attachment relationship to work through that confusion, whether that's with the parent or with the therapist. They need somebody safe to talk with about it, and really educating them on healthy sexuality and sex addiction if appropriate. Okay, so we do have about 9 minutes for questions. Excellent. So, do you have any questions for me?
Yeah, we have someone asking about the delayed disclosure. They want to know if it'll be okay when they when the child reaches later teen years, if they can discuss more details about why dad is gone, and if they can tell the child he was and still possibly remains an addict. Yeah,
some of these types of questions, when they're very personal, are probably going to be hard to answer, because for me that brings up a lot of questions like, is Dad in their life anymore, and is, what's going on with the whole system. I'm a systems trained therapist, so I want to look at everything. And one of the reasons why is you want to make sure that that the child still has permission and support in loving that parent, that other parent. And that's just the case in any time when there's a divorce situation or a rupture and a dissolution of the marriage. And it can be one of the most challenging things. And this is, I'm a divorcee, and this has been challenging in my own life. But, my children do not have all the information of what went down in my marriage. And it's very hard for me to sometimes lift my ex-husband up in their eyes. But it's so important for them to have that, father figure that they can love, and they feel like they're a part of him. So it's a very challenging, that's a very tricky question, and I would want to know more about the parameters. So that's my response to that one. I'm sorry I can't be more thorough on that answer. But I would suggest really teasing that apart with a therapist. So, yeah. Tom, another question?
We have a question if there are inpatient residential programs for partners and children.
Not right now, but stay tuned, because I know that there are a couple opening up like this year. So there was one and at a place in New Mexico, but it shut down. But there are still some good treatment options out there. If you go to the ITAP website, there are a lot of resources. Go to sexhelp.com, and there are a lot of resources of treatment facilities out there, so you can look at that resource.
Okay, we're having a couple people ask us to clarify the difference between sex addiction, love addiction, and chronic infidelity. As a partner, this person says, I'm very confused and getting different information from partners, therapists, my therapist, etc.
Right. I'm not surprised that they're confused. So I actually, I've gotten this question a lot, and one of the things I did was kind of create a chart. And part of the confusion is because there have been many, many authors that have written on these topics, and many, many different definitions of these things. And so now the definition for sex addiction is pretty clear. And, that's where there's a set of diagnostic criteria. Do they meet these? There's testing available. So you should be able to get a handle on whether somebody's a sex addict. Now, love addiction, probably the most famous author on this is PM Melody. And PM Melody is her view of love addiction is it's more about the needing of that love and attention and that craving of that. And that can be from one person, like you're trying to get that from one person. And oftentimes this is in a relationship with somebody who she calls love avoidant. And so there's sort of this dance of not feeling like you get enough love. And so you might go to a different relationship to get that, or bounce from relationships to try and feel like you're loved. And that's in contrast with relationship addiction. There have been several authors on that. And if you probably one of the most popular ones, is it Schaaf, I think? But anyway, relationship addiction is more often looked at as somebody that goes from one relationship to the next relationship, or has multiple going on at a time, or one on the back burner. And sometimes sex addiction can have elements of these in the type of acting out. So like, for example, there's a subtype of sex addiction called conquest, where it's really about, meaningless sexual relationships and just like emotionless relationships, which is, and oftentimes it doesn't have so much to do with the relationship as it does with the sex when you're talking about sex addiction. So it's not a surprise that you're having confusion, because there are many different books written on these subjects and people are trained in different ways. So that's why you're probably having some confusion about that. Yeah, okay. One more question I think we have time for.
Okay, we have a couple people asking about the healthy use of porn. So here's one question. Can you clarify the difference between the healthy use of porn or using porn clubs or escorts to fulfill masturbatory needs or frustration from poor sex or intimacy within the coupleship, differentiating that from the need to use those for addictive reasons?
Right, okay. So using porn is almost, if you look at especially the 17 to 14-year-old male age group, 75% use porn regularly. So when you're looking at a population like that and you're seeing that many people, it's almost like normative in that group. So it is about the amount that is being used and the purpose of that for which it's being used. So, if you look at somebody, it is a big difference between somebody that's using it once or twice a week or maybe even 3 times a week and just having a masturbation session of, 15 minutes and then move on and that's it, versus somebody that's starting to take a significant amount of time and it's starting to get in the way of their life. Once you start seeing consequences in their life where it's interfering with their functioning, starting to really interfere with their relationships, one of the areas that starts to become really problematic with use of porn is erectile dysfunction. We're seeing more and more males, young males, not being able to perform sexually because of their use of pornography. So when you're starting to see, and also if they're using it to cope with their feelings, like it's in long periods of time, shutting people out for long periods of time, that's when we're starting to see a problem. So you'd want to, in those circumstances, refer to a therapist that can really do more of evaluation and get in a little bit deeper level and see if it's a problem. Okay, well, I'm noticing that we're out of time, so I want to thank everybody so much for coming, and I enjoyed it, so thank you.